The question is that this bill be now read a second time, and the member for Hasluck has the call.
Deputy Chair, I rise to oppose the suite of bills titled Fairer Private Health Insurance Amendments. And I do so on the basis that what is proposed means that there is a reduction, and I won't cite all the figures because it's been evident in all the speeches I've been listening to during the course of the day. But it does impact on the health system. And when I first entered the reform period under the Rudd government and later in its continuation with the Gillard government, I saw incredible hope and opportunity for both the reforms to be effective, but for the private sector and private sector funding to be a key player in all of this. And that the 30% levy would allow people the opportunity of moving between the health services provided both within public hospitals and the private sector. And by that I want to give an example of St John of God in Perth that has robotic surgery for men who have prostate cancer. The cost of that is significantly high, and the difference in price is covered by the private health insurance that is provided through membership and underpinned by the 30% element that assists people to continue with their private health insurance. I suppose the other thing that disappoints me is that the Healthier Future for all Australians talked about a continuity of care, access to specialised services and the ability to be part of making a choice about the type of healthcare service delivery you would access and the point at which you would access it. It's also interesting in the national partnership agreements that have been negotiated because it does make reference to the fact that all Australians should have the opportunity of moving between the choices that exist for them, but they don't have always the capacity to pay. And there are private and government hospitals that have differing services, and certainly a significant number of the specialists tend to operate within the private health sector. And the elective surgery waiting lists and surgery is enhanced in moving your way through the waiting list if you are covered by private insurance, because you're often sometimes advised to take that opportunity and book into a private hospital in order to expedite that service. It means that you don't remain on a waiting list for a substantial period of time. But the articles that have been appearing in the papers of recent times make some very interesting points for this debate. The Australian on Monday the 13th of February 2012, both sides failing the test on health. Labor's policy lacks coherence, but this should not let the opposition off the hook. First, as the public and private systems compete for health professionals, it will increase costs, reduce quality in the public health system. Second, it'll make the PHI even less affordable for low-income consumers, ensuring that we truly do end up with a two-tier health system, one for the better off, who will be forced to have private cover, and one for those on lower incomes who will have to rely on the public hospital. Again, Gillard confident on health rebate, the Australian Financial Review on Tuesday the 7th of February. Prime Minister Gillard said yesterday taxpayers should not have to subsidise private health insurance for wealthy people, and the government would continue discussions to get the changes passed. Bob Brown, Greens leader, yesterday softened his party's resistance. We don't believe people should be penalised because they make the choice to go with the public health system, he said. We are continuing to talk with the government. I think I've been dismayed also by the fact that there has been a number of speakers on that side of the House who refer to a welfare or class system when it comes to the subsidisation of the health rebate, because to me it's not that. I think that we have to be serious in considering that we want to encourage people to access the opportunities to reduce the burden on the public hospital system. One of the continued debates I had when I was in health, when we used to meet as an executive, was the choking of public hospitals from people who could not access the private health sector or access specialists whose time was principally involved with the private health sector. And what worries me with this one is if those figures are correct about the 1.6 million consumers dropping their health insurance, or the number that fall in under each of the tiers, then we'll see an increase in the number of people accessing the public hospital system. And that in itself will increase the requirement for funding to meet those health needs, when in fact it could be covered within the private health sector. In reading through the national partnership agreements, there are some provisions for increased funding where there are pressure points within the context of the public health sector under each state and territory's jurisdiction to negotiate a variation to those actual costs. I would suspect that we will see an increase by state and territories in asking for additional funding. And with that in mind, the Hobart Mercury on Monday the 13th of the 2nd, 2012, private insurance bypass, doctors warn rebate changes will up pressure on public hospitals. Tasmania's public hospitals will be hit with more patients under plans to means test the private health rebate, the AMA says. Premiums are tipped to rise by up to $1,000 a year for families from 1 July, with Gillard government legislation to be voted on in the coming days. AMA Tasmanian President John Davis said, "What we are already seeing is the Royal Hobart Hospital working at capacity at what should be a quiet time of the year." If that is the case in a quiet time, then those changes that are proposed will be a significant impact on hospitals. I was down in Tasmania recently and I was speaking with the senior official from health, and they were indicating that the quantum of money received to provide for their hospitals and for the types of services required for the public of Tasmania is not sufficient. And on that basis, I suspect that we will see health ministers coming back to the discussions with the federal minister seeking to increase their share of some of the Commonwealth funding that would assist in the provision of healthcare that we expect and take for granted in this country. I know that the Health Minister believes these changes will ensure that those with greater capacity to pay should make a larger contribution towards the cost of their private health insurance. The government says it will ensure that government support for private health insurance remains fair and sustainable in the future. This is simply not the case. In my electorate of Hasluck, I have a geographically and economically diverse electorate in which there are many people who are feeling the pressure points of increased costs of living. And those increased costs of living are impacting on their capability and capacity to pay their private health insurance premiums. And I've had constituents say to me that they will be dropping the level of contribution they make to private health funds, which to me is a pity, because when there is an illness of some magnitude that is important and requires a coverage of the full fee, or at least the gap, then they will be deprived of that, and their out-of-pocket expenses will certainly increase. The extra costs will hit families hard and drive more towards the public system. The public health system is already under strain, and this could be the straw that breaks the camel's back. Costs from increased living will also be an impediment, not only on hospital costs and the payments you have to make for the anaesthetist and some of the surgical procedures, but also for the medications that will be required. Over 1.5 million Australians, including thousands in Hasluck, will face significant increases in private insurance costs. $1,000 mightn't sound a great deal to many in this chamber, but let me tell you, there will be people who will struggle to find that within their tight economic circumstances, particularly with the other added pressure from the bank sector or the banking sector, where there is an increase in home interest rates. Private hospitals treat 40% of all patients in Australia and perform over 60% of elective surgery. What happens to the public systems when these patients scrap their health insurance? The government-owned insurer, Medibank Private, has predicted that 37,000 of their members alone will drop their cover and 92,500 will downgrade. This is considerably more than the 27,000 that the Minister has claimed will drop their cover throughout the entire sector. To me, this is another example of the Labor Party playing politics of envy and punishing those that are able to take financial responsibility for their health care, instead of the Liberal Party economic philosophy of reward for effort and providing people with choice and financial opportunity. Many of the people that have taken out private health insurance in Hasluck are not super rich as those opposite would have you believe. In the near future, you will hear more political speak coming out of the Labor Party saying things like, they are rich, why should they get subsidies for private health? This is social engineering coming to the fore yet again. These people are already paying for the services of private health insurance, and this takes a significant load off our public health system. And if we contemplate that, we would have seen articles over a period of time in which health systems and jurisdictions are talking about the burden of costs in the delivery of health services. I've had that first-hand experience actually working in the health sector at a senior level, and I know the strain many in this system are under. These changes will just make things worse. The phasing down of the health care rebate to nil would see nearly 200,000 hospital beds days needed to be created. 1 million extra patients are expected to flood the health system. The Gillard government is acting out of desperation to balance its books and is doing so at the expense of many hard-working Australians and the people in my electorate of Hasluck. Instead of creating hope for the people of Australia, if they work hard and pay their way, they will be rewarded. It penalises the people who are paying for their way. Cost of living is a serious issue, as I've said in my electorate, and the so-called tough luxuries and the so-called luxuries will be jettisoned, and I fear that private health insurance could be one of them. The cost of living pressures will only get worse under the carbon tax regime, and this wasteful government is introducing another burden. The deceit shown by this government knows no bounds. Every new tax or levy introduced chips away at the household budget. People in Hasluck are struggling, and this is a typical tax and spend approach to economics is damaging to the social fabric of this country. I would ask the Health Minister to come to Hasluck and talk directly to families in a forum that will be hit by the amendments to the legislation. Previous governments have rejected these changes, and I call on this government not to dig its heels in and to stop this lunacy. What makes this worse is that the Prime Minister previously stated in opposition that she would not seek to remove the rebate, yet when political convenience occurs, she once again goes back on her word. The former Prime Minister, the Honourable Kevin Rudd, and the former Health Minister, the Honourable Nicola Roxon, have both gone to great pains previously to say they would never support this move. What's changed? This is the third time that Parliament has considered this legislation. It was introduced in the last Parliament despite explicit responses at the 2007 election. Federal Labor made it crystal clear that we are committed to retaining all existing private health insurance rebates in a media release by Nicola Roxon on the 26th of September 2007. I call on the independents to actually stick up for the people in their electorates and vote down these amendments which will hurt everyday Australians. I think that we have the basis of an incredible health reform agenda that is providing a wide range of health outcomes and improvements for Australians, and consistent with the objectives of the National Partnership Agreements and the National Health Reform Agreement. I would rather see the strengthening of those and not the diminishing by the impact of this legislation in reducing the rebate that is given currently to all Australians. And I would, Mr. Speaker, oppose this legislation.